My trade union of doctors in Poland is 21 years old. During this time, 21 years, we tried to discuss. Sometimes we had a strike, sometimes we had a big fight against the decisions of government. Now we have impression that we stayed at the wall and we have no possibility to talk in anybody in Poland which is responsible for healthcare. Then our decision to present that problem in Parliament, the European Parliament, is the same like decision of before countries. And I want only say, like Janusz Beltecki, the same. We hope that we will be successful.
We observe the situation in all European countries. And what we can see on our agenda, each time, again, the same problems from the before countries. Each time it's the problem of emigration, of too low salaries, of impossible working conditions, of no efficient efforts by the governments to improve the situation in those countries. And especially this ratio between the salaries in the western part of the European Union and the eastern part of the European Union is something that is not bearable. And therefore, of course, this causes so many problems. And the way of how the Slovak government tackled this problem recently is really something that makes concern within firms. So these methods of persecuting trade union representatives is unacceptable. For a democratic country in the 21st century, in the European Union, it is not acceptable to have a kind of criminal or even worse, even administrative procedure of taking away a license just because a doctor won't perform his duty to say what is needed to improve the care for his patients.
If we have a look at the situation here in these four countries, well, it's much, much worse than in the other areas of Europe. So when we consider that there will be, by 2020, it's expected from the European Union, a unsatisfied need of 13% of doctors, and that we have the free circulation of doctors all over Europe, and these four countries, they are on the borderline with Germany and Austria, but it's easy also to reach other areas of Europe where there is already a strong lack of doctors. So it will be a problem for the people to be cared. It's necessary that people know deeply the reason why there is this activity of medical trade union in this area, because they cannot think that it's justified for salary reason between doctors and the government. Because, of course, when you have a strike in public services, the victim of the strike in that moment is the citizen. It's not like a strike against an employer. It's not a problem. So it's necessary to let people know what's happening and why. Because in this situation, they are not just having a problem on the day of strike. They are facing huge problems for the rest of their life if the situation will not improve. We want to say to the government of this area, be careful and don't consider the doctors who are fighting for a better health system your enemies. You are your best ally because they know better than anybody else how is the situation and how the situation can be improved. So the fact that the press is present here is very, very important because it's your responsibility to let people know what's really happening, because the future of the citizen here, if they don't make a stop to the bad working condition and the bad situation and the financement of the system and bad organization, well, it will reflect on their health for the future.
According to Hungarian legislation in public sector, impossible strike organization. Impossible. It was changed 1 year ago and 2 years ago, and I think it is a very responsible issue. We, doctor, physician, are responsible for patient, and I think it is a most important issue: money enough for healthcare or not enough. And all 4 countries don't have enough money for healthcare.
We have impression that our communication with Polish government is not possible. We tried many times. We have many propositions, but nobody wants to talk with us. We had a strike, big strike in Poland in years 2006 and 2007. In that strike, for 700 hospitals, over 500 was in strike. Strike is possible in Polish law, but of course the forms of that strike was very different in many hospitals. It means that the doctors made their work, for example, before 8 o'clock to 12 o'clock in the morning, and after they had a strike. Or they stay in hospital and work only with urgency. Of course, it's not good method for this, but we were in that moment in so bad situation that our decision was so. Now we think about another form of solution of this problem. It is not a strike, it is not emigration. We start to prepare for this autumn the same action which was made in Czech Republic and Slovakia. The name of this action is Thank You, We Go. So I think that in autumn we will ready to make this action, and many doctors think about the same solution.
The doctors must have a right to strike. Under certain, let's say, modalities, a little bit different way that in the private sector, but basically, so this basic right should be maintained. The problem is not the problem to the right of the strike. The problem is the communication. How can you expect healthcare in a country to work well? And how can you expect to develop the culture of, let's say, of the doctors that are available to citizens if the governments that are responsible to communicate, they are there, they are paid for this, to communicate with the citizens. And if they don't want, they don't know how to communicate with the citizens, how can you expect that such governments can resolve a system like a healthcare, which is based on the communication? So this is for me, the strike is not the worst thing. The strike is a mean of expressing of grievance of something of workers that want to express their dissatisfaction.
We have the situation a little bit the same like in Czech Republic and Slovakia. When we start to talk with government start with media campaign against doctors. And this media campaign is very strong. Every day you can see in TV bad doctors which made bad things. It's not only campaign, because sometimes it's more. In my region, I'm living in Upper Silesia. In this region, in the same time, 14 trade unionists was fired from work when they start to talk with local government. I'm living example of this situation because I was fired from my hospital 3 years ago, and during these 3 years I was going to court And last week I was one. Now I am working for verdict. Next living example is Dr. Antoni Rybka sitting here, from region of Lublin in Poland, which was fired from work in the same time. Why they do it? It's very simple. Polish government wants to privatize all Polish hospitals in the same time. And Polish trade union of doctors are against this bad, stupid idea.
Some years ago, FEMS was the first to organize the strike before the European Parliament in Strasbourg. And our Polish colleagues came with 2 buses.
Czech too.
Czech too, yes. And only 2 days later, it took let's say the broader European Trade Union Cooperation organized the strike. And because of that strike, the European Working Time Directive is such as it is. Otherwise, all here people would have some working time with some very incredible opt-outs with up to 70 hours and so on.
Most important thing that can happen now is that local people, local I mean Slovakian, Czech, Hungarian and Polish people are well informed by the press about what's happening. Because only in that way, locally, the people can ask for an improvement of the situation.
Ďakujem veľmi pekne za účasť. Dovidenia.